Hi everyone, welcome to Medicine Note YouTube channel. In this video, we are going to see about lung abscess. It is an important topic in general medicine. It is a collection of purulent material in a localized necrotic area of lung parenchyma. The lung abscess means there is a collection of purulent material in a localized area, localized as well as a necrotic area of lung parenchyma. The word parenchyma indicates that in that place there is gaseous exchange takes place. So when there is any pus forming cells present in that place and the pus is produced, this is known as lung abscess, the collection of purulent material in localized necrotic area of lung parenchyma. Now we will see the etiology of this lung abscess. The necrotizing infection is the first etiology, which is due to pathogenic organisms, fungi, anaerobes and mycobacterium. And when there is embolic infraction with cavity formation, there is cavity formation due to embolic infraction. Embolic means any blood clot, fat or air bubble embolism. This makes the place not to supply blood for the specific area, so that in that place there is infraction occurs. So embolic infraction with cavity, and there is a cavity formation in that place. So it is known as embolic infraction with cavity formation. And lung malignancy, bronchogenic carcinoma, metastatic lung abscess, and miscellaneous. This is a fourth one, which is infected congenital cyst. These are the etiology of this lung abscess. Now we will see about the pathogenesis. The pathogenesis is infection without obstruction. The first one is infection without obstruction, as well as infection with obstruction. It is obstruction without infection. These are the pathogenesis. Now we will see about the clinical signs. The signs and symptoms of the infection. There will be fever, sweating, tachycardia and increase in respiratory rate. The patient gets fever and sweating, tachycardia, that is increase in heart rate as well as increase in respiratory rate. Signs and symptoms of the obstruction. When the patient got obstruction, what are the signs and symptoms? The signs and symptoms are dyspnea, chest pain, hemoptysis, purulent sputum and tachypnea. Dyspnea means difficulty in breathing. There is chest pain is seen. Hemoptysis, in the blood, there is sputum is present in the blood. Bloody sputums are present, as well as purulent sputum and tachypnea. Now we will see about the investigations. The investigation are blood examination, sputum examination, urine examination. The proteinuria. When urine examination is done, because in the urine there is proteinuria, which results in albuminuria. This albuminuria, which causes amyloidosis, which is present in the amyloidosis, and this results in a complication which is known as lung abscess. Chest X-ray is done. There is radiolucency due to the pus forming cells and pus present in the lungs. CT chest also taken. These are the investigation of the lung abscess. Now we will see the treatment. The treatment is antibiotic, which is oral amoxicillin given 500 mg 8 hourly. After 8 hours, there is 500 mg of amoxicillin is taken for 5 to 7 days. Postnal drainage. Postnal drainage means draining the abscess by gravity by suitable posture. The patient is said to be in a suitable posture, that by the gravity itself, the abscess gets drained. It is known as postnal drainage. Bronchodilator and mucolytics are used. Due to the presence of pus cells in the bronchus as well as lungs, the bronchodilators are used, and due to dilate the bronchus, as well as mucolytics, the mucus secretion is stopped. And the drainage is by tube thoracotomy as well as intercostal drainage. Chest physiotherapy is given, as well as surgery is done when it is needed. Thank you. If If you like this video, please to like, share and subscribe my YouTube channel. If you have any doubt in it, please to comment it. If you want any other video, please to suggest in the comment box. Thank you. Please to subscribe.